Welcome to the History in Focus channel. Be sure to subscribe so you don't miss more videos like this one. At the U.S. Air Force Institute of Aviation Medicine in Randolph Field, Texas, Corporal Charles F. Morris poses with two enormous eye models used for teaching. Powered by small motors, they demonstrated eye muscle movements and even lit up to simulate real-time actions. Developed by aeromedical researchers, they helped students understand vision in flight conditions. Children gather around an ultraviolet light at the Institute of Ray Therapy in the United Kingdom. This treatment was used to stimulate vitamin D production and strengthen the immune system, especially in places with little sun exposure. At the time, it was believed that UV therapy helped prevent diseases like rickets and was widely applied in schools and hospitals. A man wears Dr. F.G. Benedict's metabolic measurement apparatus in 1935. The device captured the oxygen consumed and the carbon dioxide exhaled. The heavy, tight helmet made the test uncomfortable, but it helped study energy expenditure at rest. These experiments were crucial in understanding how the body uses energy in different conditions. At Oak Ridge Hospital in 1955, a treatment unit used cesium-137 to fight cancer. The massive ceiling-suspended device emitted intense radiation to destroy tumor cells while minimizing damage to healthy tissue. Though it was a breakthrough in therapy, exposure to radioactivity raised concerns about long-term risks for both patients and medical staff, making the procedure hazardous. Doctors use an X-ray machine in 1947 to guide the insertion of a venous catheter into a patient's heart. This innovative procedure allowed real-time visualization of the catheter's position inside blood vessels, aiding in the diagnosis and treatment of heart diseases. The technique was a milestone in medicine, paving the way for modern interventional cardiology. A woman undergoes a procedure with a freckle removal machine around 1930. The device kept her head and eyes immobilized while a chemical substance was applied to her skin. Treatments like this were promoted to improve skin appearance, but many caused pain, scarring, and unpredictable side effects. Dr. G.H. Byford is trapped inside a spinning optokinetic drum at the RAF Institute of Aviation Medicine in Farnborough in 1960. A miniature lamp is cemented onto his contact lens, while bizarre tubes extend from his mouth. The experiment aims to study eye reflexes and visual illusions, but the scene looks more like a torture device than a scientific study. The pre-PET cap, created by the Instrumentation Division of Brookhaven National Laboratory, USA, was one of the first devices for studying brain function. Developed before positron emission tomography, PET, it helped map brain activity and understand neurological processes. These studies were fundamental to the advancement of modern neuroscience. At the Roentgen Institute in Frankfurt around 1929, a patient is positioned in the modern Roentgen look-through machine. The device was designed to perform X-ray examinations without directly exposing the doctor to radiation, providing greater safety. With a rotating structure and adjustable supports, this technology represented a significant advancement in radiology. Postal Department Inspector D.F. Angier tests a stretching device under the supervision of Dr. L.F. Kebler in 1931. The apparatus promised to increase height by 2 to 6 inches by stretching the spine through neck traction. Without scientific validation, these devices were eventually discarded as medicine and understanding of human growth advanced. Winston Churchill needed a special pressure chamber to safely endure high-altitude flights. This device, developed in 1947, maintained proper oxygen and pressure levels, protecting his body from the effects of the thin atmosphere. Custom-built, it resembled a hermetically sealed metal capsule, ensuring he could travel without compromising his health. A doctor adjusts the beam path of a 2,000-volt deep therapy X-ray machine at Francis Delafield Hospital in New York City. This equipment was designed to treat cancer with precision by directing intense radiation at tumors. The advanced technology for its time represented hope for many patients, despite its imposing size and complex operation. An elderly man relaxes while his legs are inside a machine that stimulates blood circulation in the 1950s. The device uses controlled pressure to improve blood flow, helping treat vascular problems. For those suffering from poor circulation, this was an innovative option, preventing severe complications without the need for surgery or invasive treatments. A patient undergoes treatment with the cobalt bomb at a clinic in Paris in 1959. The device delivers controlled radiation to destroy tumors without surgery. This technology was a major advancement at the time, allowing for more precise cancer treatment. Despite its intimidating appearance, the machine helped improve survival rates for many patients. This little girl, photographed at King Edward VII Children's Hospital in Birmingham, undergoes an examination with an orthoptic device to correct strabismus. The apparatus, with adjustable lenses and metal supports, projected different images into each eye, forcing the brain to align vision. Despite its intimidating appearance, it was an alternative to strengthen eye muscles and avoid surgery. Here we see a 1920s dental X-ray device. The equipment directed radiation to capture images of teeth and the jaw, but at the time, X-rays were overused, applied indiscriminately. Only years later, with the understanding of harmful effects such as burns and increased cancer risk, were safety protocols established. A peculiar device was created in 1957 to keep children still during chest X-ray exams. The child was positioned in a rigid support while sitting on a toy horse, ensuring they would not move during the procedure. The unusual design helped calm young patients, making the exam less intimidating. A patient undergoes lateral cerebral diathermy treatment in the early 1920s. The procedure used electrical currents to stimulate the brain and was applied to people with psychosis. The idea was that electricity would help control symptoms, but doctors soon realized the method was unsafe and unreliable, leading to its abandonment in psychiatric practice. A radiologist operates an X-ray machine at an exhibition in Central Hall, Westminster, in 1934. To protect himself from radiation, he wears a lead apron, thick gloves, and a shielded helmet with a narrow visor. These protective suits were necessary at the time because early X-ray machines emitted high doses of radiation without the safety features of modern models. Dr. Clark's spinal device around 1878 was an attempt to correct scoliosis through a rigid support. The child was strapped into a tight corset and a vertical frame with a pulley system to stretch the spine. Mounted on a wheeled structure, it allowed some movement but was extremely uncomfortable and impractical. During World War I, soldiers with psychoneurotic disorders were subjected to electric treatments in the so-called ergonomic chair. The patient was strapped to the structure while electrodes delivered shocks to different parts of the body. The machine was intended to produce a curative psychological effect, but the method was painful and highly questionable in its effectiveness. A patient lies with electrodes attached to his face while a device measures retinal electrical activity in the 1930s. This exam, called an electroretinogram, was developed to analyze the eye's response to light and diagnose ocular diseases. Though it seems like a strange experiment, this technology was crucial in better understanding vision and is still used in ophthalmology today. A man demonstrates a 19th century posture correction machine. The device, one of 70 inventions by physician Gustav Zander, used levers and gears to force the body into the correct position. These machines were popular in medical gyms of the time, where mechanotherapy was believed to strengthen muscles and treat postural issues. A child is in an oxygen tent used in the early 20th century to treat respiratory problems. The device supplied concentrated oxygen, aiding recovery from diseases like pneumonia. Connected to gas cylinders and regulators, it was an alternative to iron lungs in less severe cases, helping patients breathe more easily. Facial prosthetics were used to cover injuries in the early days of plastic surgery. These pieces, made of metal, leather, or porcelain, replaced lost facial parts due to accidents or war injuries. Many were attached to eyeglasses for better fixation. During World War I, the demand for prosthetics grew, driving advancements in facial reconstruction and more refined medical techniques. A Wiener ambulance transports patients in layers inside a wooden horse-drawn carriage. The sides are partially open with curtains for protection, and the interior has shelves to accommodate stacked stretchers. Operated by the Vienna Voluntary Rescue Society, this ambulance allowed multiple injured people to be transported at once, making emergency response more efficient. A man is lying down with an unusual device attached to his head while a doctor observes closely. The apparatus, equipped with articulated metal rods and electrodes, measures his brain waves and neurological reactions. This scene was captured in the United States in 1940, a time when neuroscience research relied on rudimentary and often uncomfortable methods for patients. A woman is inside this electric chamber at the Light Care Institute in the early 1900s. The equipment uses incandescent lamps to heat the body and stimulate circulation, promoted as a treatment for pain and fatigue. Though popular at the time, the risk of overheating and burns was real, as temperature control was limited and often inefficient. The lunatic chair was used in a Dutch psychiatric hospital in 1938 to restrain patients who were having outbursts or were aggressive. Strapped into a straitjacket inside the wooden structure, they also wore a face cage to prevent biting. This type of restraint, common at the time, seemed more like punishment than treatment, before more humane methods emerged. At Walter Reed Hospital in Washington, D.C., in 1920, patients underwent treatment in thermal cabins. Only their heads remained outside, while intense heat enveloped their bodies, helping to relieve pain and improve circulation. This method was used to treat joint problems and inflammation, considered an innovation in physiotherapy at the time. A woman undergoes scoliosis treatment in the 19th century, suspended by a traction device to stretch her spine. While doctors adjust her body, a rigid corset is molded to maintain correction. These methods were used before modern corrective surgeries and could be painful. Some patients had to wear the corset for months to attempt spinal realignment. A woman undergoes an X-ray with a new shock-proof machine at the London Medical Exhibition in 1934. The fascination with X-rays led to the creation of devices for offices and even home use without knowledge of the risks. The equipment was practical, but frequent exposure to radiation without proper protection increased dangers for both patients and doctors. Chemist Wright H. Langham of Los Alamos observes Plastic Man, a transparent mannequin created to simulate human body exposure to radiation in 1959. Made of special plastic, it helped study how radiation affected internal organs. Langham was also involved in controversial plutonium experiments on humans conducted by the U.S. government in the 1940s. A chest X-ray is being performed at Dr. Maxime Menard's Radiology department at Cochin Hospital in Paris, around 1914. The patient stands inside the booth while an image of his lungs appears in real time. At the time, radiation protection was minimal, and Menard himself later lost a finger due to the harmful effects of prolonged X-ray exposure. A man is strapped into a 19th century spinal traction device used to correct spinal problems. The equipment tilted the patient backward, stretching the spine to relieve pain and misalignment. These devices were used to treat scoliosis and other conditions, but many lacked scientific backing and could be painful. A man undergoes radioscopic thermotherapy on his leg using a radiation device to treat injuries and muscle conditions. This early 20th century method heated tissues with rays, stimulating recovery. However, excessive radiation exposure posed risks such as burns, tissue damage, and increased long-term cancer risk. A man undergoes a demonstration of a new X-ray device in London, 1932. The equipment used vacuum tubes to emit radiation and produce more precise images. The examination was relatively quick, but the patient had to remain still to avoid distortions. Despite its practicality, the high intensity of radiation could slightly heat the skin during exposure. In October 1937 in Rio de Janeiro, a woman undergoes an examination using Roentgen photography, a technique created by physicist Marius de Abreu to detect lung diseases. The method used a short-duration X-ray to capture clearer, more detailed chest images. This advancement enabled faster and more accessible diagnoses, widely adopted in the fight against tuberculosis. This 1860s dental tool was used to treat cavities in a rudimentary manner. The blades held the tooth while a screw-like drill bored into it to remove the affected part. Without effective anesthesia, the procedure was extremely painful. These instruments contributed to the bad reputation of dentists at the time before less traumatic techniques were developed. A rotating cobalt machine spins around a patient's body, emitting radiation to treat cancerous tumors. This 1955 equipment was a breakthrough in radiotherapy, allowing more precise cancer treatments. Its rotating mechanism helped distribute radiation in a controlled manner, reducing damage to healthy tissues and increasing the procedure's effectiveness. Sitting in an armchair, a woman smiles while using a portable respirator in 1955. The device wraps around her chest and is connected to a ventilation system to assist her breathing. Designed to allow patients with respiratory paralysis to be treated at home, this model was an innovation at a time when polio still posed a severe health risk. A wire suit covers the volunteer's body, wrapping him from head to toe in a tight metal mesh. Small sensors are connected to the rigid fabric to measure body temperature under extreme conditions. Developed for research on high-speed effects and space travel, this 1960s equipment gives the wearer the appearance of a horror movie villain. This is the first electrocardiograph created by Cambridge Scientific Instruments. To use the device, the patient had to place their arms and legs in containers filled with saline solution, which helped capture the heart's electrical signals. Despite being enormous and complicated, this equipment was a significant step for medicine, paving the way for the modern electrocardiogram. Trapped inside an iron lung, a man relies on the equipment to breathe. The machine uses negative pressure to expand the lungs, replacing the natural breathing motion. Widely used during the polio outbreaks of the 1940s and 1950s, this technology was crucial in keeping patients alive who had lost their ability to breathe due to virus-induced paralysis. The new hip massage machine in the United States around 1928 promised to shape the figure effortlessly. Using a vibrating belt, the device massaged the hip area, believed to help reduce inches. These machines were popular at the time, marketed as easy alternatives to exercise, though their effectiveness was highly questionable. A nurse hands a towel to a woman lying in a thermal bath in 1934. The equipment emitted heat from lamps behind a metal grid to relieve muscle tension. Before electricity was used, older versions of these chambers relied on heated coal to generate warmth, making the process more labor-intensive and less controllable. A woman wears a flu mask connected to a tube while reading in 1919 during the flu epidemic. The device was designed to filter the air and protect against the virus, but its effectiveness was uncertain. With few options to combat the disease, measures like this were widely adopted as the world faced one of the deadliest pandemics in history. Iron lungs, such as the Drinker, Emerson, and both models, could be operated manually or mechanically. Typically, they were powered by an electric motor connected to a flexible diaphragm at the opposite end of the patient's head. This mechanism regulated the pressure inside the cylinder, allowing air to enter and exit, essential for those who could not breathe on their own. An artificial kidney machine in operation around 1950. The patient undergoes hemodialysis while nurses and a doctor monitor the process. The device, one of the first of its kind, filtered impurities from the blood when the kidneys could no longer perform this function. This breakthrough was crucial in saving patients with kidney failure, allowing treatments that were previously impossible without a transplant. During labor, this patient inhales pain-relieving gas with the help of a nurse beside her. The device, connected by a flexible tube, releases the gas, making childbirth more bearable. This method, quite innovative at the time, provided a more comfortable and less invasive alternative, helping women go through labor more smoothly. This woman is using an electric inhalation device popular in 1929 to produce a medicated mist. The apparatus helped treat colds and flu, relieving respiratory symptoms such as congestion. This technology was one of the first solutions for respiratory problems before the development of more effective treatments for lung diseases. Patients in a hospital in Germany around 1930 used devices to inhale powdered medications like menthol and eucalyptus for respiratory conditions. Vapor inhalation became a common practice in sanatoriums at the time, widely used to treat lung problems, even before antibiotic treatments were developed. The Dubois anesthesia machine, created in France around 1913, was used to administer anesthesia to patients during surgery. Before devices like this, anesthesia options were limited and often ineffective, making pain during operations a major problem. Dubois' invention was a significant advancement, making surgeries safer. Lieutenant Radke performs a blood pressure test using an unusual method for the time. He blows into a tube connected to a mercury column to maintain constant pressure while the doctor measures his circulation. Unlike modern devices, which perform this measurement automatically and accurately, this procedure required patient effort and detailed manual control. A doctor wears a plague protection suit in Manchuria around 1912. The padded clothing, goggles, and mask helped prevent infection during the rapidly spreading pneumonic plague outbreak. The white suit was chosen to reflect sunlight and maintain body temperature, while the mask filtered the air, preventing the inhalation of infected particles. A man demonstrates the Sunvaray dental lamp on a patient at the 1927 Light and Heat exhibition in Central Hall, Westminster. The device emitted ultraviolet rays to treat oral infections and strengthen teeth. At the time, ultraviolet light was believed to have healing properties and was used in various medical fields. A boy lies in an early model wheelchair, used for patients with fractures or leg paralysis. This elongated design allowed the patient to remain in a horizontal position while moving. The modern wheelchair was patented in 1932, but before that, models like this were common with limited adjustability and comfort. Two women undergo magnetic therapy using devices with coils applied to their arms and legs. The treatment was promoted as a solution for pain and joint problems. Some variations of the therapy were also used to improve sleep and overall well-being, making it popular in clinics and spas in the early 20th century. A little boy is in a hydrotherapy tank in 1950, used to treat muscle and joint conditions. At the time, this treatment was widely used for the rehabilitation of polio victims, as floating in water allowed movement without impact, helping in the recovery of strength and mobility. A patient in Harrogate, England, receives treatment with an electric machine around 1910. The device was used to treat burns and rheumatism by applying low-intensity electrical currents to stimulate circulation and relieve pain. These therapies were common in medicinal spas in the United Kingdom, despite the lack of evidence regarding their effectiveness. The jet injector, created in the 1960s, facilitated mass vaccination against smallpox by injecting the drug into the skin using pressurized air, without a needle. Fast and efficient, it allowed thousands of people to be immunized per day. However, since the same nozzle was used on multiple patients without proper sterilization, there was a risk of cross-contamination, leading to its replacement by safer options. A woman with an artificial leg poses between 1890 and 1900, hiding her face in apparent shyness. Prosthetics at the time, made of wood and leather, were uncomfortable and limited mobility. The stigma surrounding amputation made many people avoid displaying their prosthetics, making this image a rare record of the reality faced by amputees. These are the instruments used in lobotomies performed by Dr. Walter Freeman, who believed he had found a solution for mental disorders. With few tools and no anesthesia, he cut connections in the brain, leaving many patients apathetic, emotionless, or without autonomy. For years, this procedure was seen as a promising treatment until its irreversible damage became evident. A doctor conducts a neurological examination with an electrical device in 1878. The machine, a metal box with wires and electrodes, sent currents through the patient's arm to test reflexes and muscle contractions. With buttons and levers, the intensity of the current could be adjusted. Electricity was seen as promising for diagnosing neurological and muscular problems. Nurses wrapped psychiatric patients in wet sheets to calm them. This practice, common in the early 20th century, used cold fabric to reduce agitation, as it was believed that cooling the body helped ease crises. Many patients remained immobilized for hours without the ability to move, in a technique that was later replaced by more humane approaches. A young woman submerges her arms and legs in buckets of water with electrical current around 1938. This treatment, called galvanotherapy, was used to stimulate circulation and relieve muscle pain. Small discharges created a tingling sensation, but the risk of stronger shocks existed, especially in poorly calibrated or improperly handled equipment. A newborn receives oxygen in Berlin, Germany, in 1939. The oversized mask covers almost his entire head, while the pressurized cylinder provides enriched air to treat respiratory difficulties. Despite being an advancement, the lack of control over dosage could cause complications, such as retinopathy of prematurity, which affected the vision of babies exposed to high oxygen levels. Field bandages and a syphilis syringe recovered from the ship Mary Rose, which sank in 1545. Doctors at the time injected mercury directly into the male organ with a thick-tipped syringe, causing intense pain. Besides the suffering, mercury was toxic, leading to poisoning and severe side effects, making the treatment as dangerous as the disease itself. These small cages attached to the leg housed lice infected with typhus. Between World Wars I and II, Polish biologist Rudolf Weigel used this method to cultivate the parasite and develop a vaccine. Volunteers were exposed to bites to feed the insects, a risky but essential process for understanding the disease and creating immunization against the epidemic that devastated populations. This 17th century iron mask was used on patients with mental disorders as a form of restraint and punishment. Strapped to the head with adjustable bands, it restricted communication and vision, preventing sudden movements. At the time, psychiatric disorders were poorly understood, and brutal methods like this were common in asylums, more for controlling patients than treating them. A woman demonstrates a 1930s anesthetic gas inhaler. The device, attached to the face, allowed the patient to control inhalation by pressing a small pump. Used in medical and dental procedures, it administered nitrous oxide or ether. Since dosage control was imprecise, it increased the risks of nausea and prolonged unconsciousness. 3 plastic mannequins filled with a sodium chloride solution were used to test how radiation affected the human body. They helped scientists measure the amount of radiation absorbed. Over time, exposure caused damage, making the plastic deteriorate and the mannequins become contaminated, revealing the real impact of radiation on materials and, consequently, on people. Women undergo radiation therapy at the Serbian Psychiatric Hospital in Serbia in 1907. The treatment was used for mental disorders based on the belief that radiation exposure could calm patients or alter behaviors. Without knowledge of its harmful effects, these sessions were applied without adequate protection, leading to severe long-term health risks. An electric light bath at the Glossop Road Baths in Sheffield. The patient sits inside the cabin, surrounded by incandescent lamps, in a treatment that promised to stimulate circulation and relieve pain. Opened after the 1832 cholera epidemic, these baths offered various therapies considered innovative at the time, though many lacked scientific validation. Invented in 1907 by French radiologist E.J. Hertz, the Hertz compass helped doctors locate and remove projectiles from the body. Used in World War I, it worked alongside X-rays to determine the exact position of bullets and shrapnel. The technique involved inserting a needle into the skin to identify the object's depth and direction, followed by an incision for removal. The Haldane mask was created during World War I to treat soldiers exposed to toxic gases. Many developed pulmonary edema and severe lung injuries. The device supplied pure oxygen to alleviate respiratory damage and increase survival. This advancement helped reduce deaths from chemical agent inhalation and influenced modern oxygen therapy.